Hi, I'm Gary White for Channel 6, Central Kentucky Television. I'm here with Dr. Tricia Ciccone from Central Kentucky Optometric Associates with offices in Lebanon and Springfield. And it's 2018, ready to start a new year.
Happy New Year, everybody.
Happy New Year, exactly. And since it's 2018, that means it's January, right? And it means we're in the middle of winter, and we've been having a very cold winter.
Oh, it's been cold.
And that also can affect your eyes. And you know, we've talked before about dry eyes, and dry eye can be a disease too, but can it be seasonal as well?
It can be. It's seasonal and environmental in January, these cold winter months that we're using real dry heat and there's not a lot of humidity in the air. Dry eye can be exacerbated, so even a mild or moderate dry eye can, be a severely symptomatic during these months. So don't suffer with your dry eyes. If you're having symptoms, come on in and let us, diagnose you and get you some relief.
What are the symptoms of dry eye?
Well, one of the number one symptoms is kind of an oxymoron because a lot of people who have dry eye have watery eyes. But that's a reflex watering of your tear reflex loop. It's not the normal lubricating tears. We make two different kinds of tears. The tears that lubricate and carry nutrients and carry waste away from our external ocular surface or our corneal surface, and then we have our emotional tears. And the emotional tears are what kind of kick in when that reflex loop, if your regular tears are not doing a good job lubricating your ocular surface, then the reflex tears will kick in, and that's when your eyes will water. So it is a bit of an oxymoron that dry eyes are watery eyes often. Foreign body sensation, the feeling of scratchiness. Sometimes if your tear film is just not, it's evaporating fast, you'll have some blurring of your vision during those times. There's basically two broad categories of dry eye. One is an aqueous deficiency where you're just not making a good aqueous layer for the tears. And the other is more of what we call an evaporative dry eye, when your meibomian glands aren't making a good lipid layer of your tears. A lot of us have kind of a mixed combination of that also. So it's important when your eyes are watering or if they're feeling dry or scratchy, chronic redness. If they're feeling drier more later in the day, that's often a sign of evaporative dry eye, and that's your meibomian glands generally that are not functioning well there. So it's just important if you're symptomatic, you got to get diagnosed because you got to know, if you're using the right medication. There's tears out there that have preservatives in them. There's tears that are non-preserved. There are what we call lipophilic tears, and there's hydrophilic tears. And so you have to know what kind of dry eye you have to pick the right treatment. And then we also have anti-inflammatory drops that we use for dry eye also, including Zedra and Restasis and sometimes even a steroid drop. So we also, for certain types of dry eye, would recommend an omega-3 supplement in your diet, and always stay hydrated. We often treat lid disease and meibomian gland disease and situations where they're contributing to a dry eye. So you need to get your dry eye diagnosed, and you need to really narrow down what the underlying causes are so that you can fine-tune your treatment, and you'll have much more successful treatment that way.
And you can get that diagnosis here at Central Kentucky Optometric
Absolutely.
Associates, right?
We are a certified dry eye management center.
Absolutely. So also, as we said, it is the beginning of the year, and as we're sitting here not too far from Springfield Hospital, who had their first baby of the 2018 on January 2nd. And when should parents start bringing children in for exams?
Really, from infancy on up, we really like to see kids, certainly before they're 2 years old. If a parent notices, even an infant or a young child, if they notice an eye turning in or turning out, or a pupil that just doesn't look the right color or the right size, anything that doesn't seem quite right, we want to get to those kids as soon as we can. So certainly before they're 2 years old, generally after that, certainly again before they enter school, and then annually after that. but kids can change pretty quickly. In those early years, we want to rule out any pathological problems. We want to make sure that their eyes are working well together and that there's not any strong refractive errors, so we can prevent amblyopia, or we prevent the delayed development of vision in one eye, and that is generally called amblyopia. If you can get to that amblyopia early, you have a good chance, if you can solve the problem, of reversing it and actually stimulating better visual development in that eye. If you don't get to it before school age, then often the child, even if you can improve the vision, often you can't get it to 20/20 or stimulate good binocular development. So get those kids in as early as you can, and again, we do like to see them early, especially if there's anything that anybody notices that seems a little off normal.
Right. Are there many eye issues that are hereditary?
There can be, sure. Certain families have farsightedness, astigmatism, amblyopia, esotropia when an eye turns in, exotropia when an eye turns out. There are, hopefully we won't ever have to diagnose anything like that here, but there are some eye cancers that are diagnosed in young children. So you just really...
It's good to have a baseline, so get in sooner rather than later.
Absolutely.
Absolutely. So also, some people, we had a question that was asked, and if you have a question that you'd like us to ask Dr. Ciccone, you can email us and we'll pass that along as well. But we had a question. They work on houses, this individual, and when they were working on the ceiling or something, they got something in their eye. If you do get something in your eye, whether it be some debris or even just an eyelash or whatever, what's the proper way to get something out of your eye?
Well, I would just use some sterile saline or some artificial tears, and just see if you can't rinse whatever has fallen in your eye out. I wouldn't really go much further than that at home, to be honest with you. If it's a chemical, you want to rinse. If you don't have sterile saline, or if you don't have any artificial tears, you just put that head right under the faucet and just, even before you call us, just rinse that eye and get that chemical out of there and dilute that chemical. If it's a particulate matter, then try a couple artificial tears, and if you can't get it out, just give us a call. You don't want to go up there with needles or magnets or Q-tips and go poking at your eye. One is you may push whatever's in your eye into your eye further. Two, you might slip and scratch your eye or cause further injury or damage to your eye. So we are available 24/7, 7 days a week, and so you can, if it's after hours, you can always give us a call, and we'll always come in. And the sooner the better, especially if it's any kind of metal or rust. The sooner we get to it before the rust forms in. And siderosis, which is when the rust starts leaking into the ocular tissues, the sooner we get to you, the quicker and easier and the less pain, and usually the quicker your recovery is going to be.
And make sure not to rub, I take it, right?
Yeah, you don't want to rub it, you don't want to poke at it yourself, you just want to come on in and let us get it out of there for you.
Great. And again, we're at Central Kentucky Optometric Associates with offices in both Lebanon and Springfield. You can call and make an appointment. And what's the phone number here to call and make an appointment? 270-692-1871. In Springfield, it is 859-336-9388. Our after-hours numbers are listed. You just call those two numbers. Both of our answering machines have them. We also have our after-hours numbers listed on our website. Top of our website, you'll see a little red cross, and you just click on that, and it'll tell you how to get in touch with any of us. Fantastic. So again, this has been Gary White with Dr. Ciccone at Central Kentucky Optometric Associates.